everyone. Thank you for joining Forge Health on this important discussion today. We are very excited about this panel discussion where we will be talking about the state of Black mental health. So expect to hear some difficult information that may be hard to absorb, but it will be a very important topic for us to discuss. We'll have a little bit of fun, a little bit of seriousness, but very excited about what is to come in the next hour. So thank you for joining us. I do know that there are people rolling in at this time, but we are going to go ahead and jump right into our agenda for today. I am Dr. Cleo-Booker. I am the Chief Clinical Officer here at Forge Health. It is my honor and pleasure to be leading today's discussion, where we will be focusing on the barriers that are hindering the Black community from accessing adequate mental health care. We do have, as I indicated before, an esteemed panelist that will be able to provide us some valuable insights into what we're seeing within our society and systemically what may be contributing to some of these barriers. Throughout this discussion today, we are hoping that we raise awareness and stimulate a very meaningful conversation to promote advocacy. We're hoping that this conversation is the start of let's talk about it, and does not stop here. Forge Health, if you are unaware of what this company is and who, I encourage you to visit our website. It is very easy to remember, forgehealth.com. Forge Health is a mental health and substance use and trauma treatment company. We have locations across the East Coast corridor in Pennsylvania, New York, New Jersey, Massachusetts, as well as New Hampshire. We provide outpatient services as well as intensive outpatient services, opioid treatment disorder, medication-assisted treatment, and medication management. We're able to customize our treatment to meet the needs of the communities in which we serve, as well as the families. At the end of this conversation, we are expecting that we have about a 15-minute Q&A session. We hope that participants will be able to kind of also share their thoughts. You can say high five, go girl, that's right, whatever you want to say in the chat. It is not, it's open for everyone to use. So please go ahead and generate conversations amongst each other and or ask your questions in that chat. All righty, let's jump right ahead. And I am going to be introducing our esteemed panelists today. So I am very excited to introduce you all to our first panelist, who is Jessica Vermont. Jessica is located in Richmond, Virginia. She is an accomplished licensed clinical social worker with over 20 years of experience in the field of social work, behavioral health, and mental health care. She is the proud owner of her own counseling and consulting company called Growth Alliance Counseling, Consulting, and Coaching, LLC. This is where she utilizes her vast experience to provide transformational outcomes to her clients. She's also committed beyond her private practice. I'm hearing someone can't hear me. I just want to do a sound check. Can you all hear me? Great, I'm going to continue. She also provides services to that goes beyond her private practice. Jessica has served in the managed healthcare role for over 8 years, where she led several large behavioral health teams. She has also been appointed by the governor of Virginia to serve on the board of local and regional jails. We're so thankful for Jessica's continuing advocacy for change and progress in the community, and very excited for her to be on this panel today. Our next panelist is one of our own here at Forge Health, Nadine. Nadine is a dually certified nurse practitioner, family medicine and psychiatry with 15 years of experience in the medical field. She has worked with various populations across a vast, numerous settings in the healthcare field, and she is a strong patient advocate for those that she serves. She has dedicated her work to making sure that there are evidence-based practices being provided across the community, as well as making sure that care is being given in a culturally competent manner. We are very fortunate to have Nadine as one of our Forge Health psychiatric nurse practitioners, and she is also a leader of our medication-assisted treatment services offered here at Forge. Kirt Lewis is our third panelist, also one of our very own within Forge Health. He is a dedicated psychiatric mental health nurse practitioner with over 14 years of experience in various mental health settings. This includes inpatient, outpatient, and even working in emergency care. He has worked over time to develop a very deep understanding of the unique needs of all age groups. His goal is to be able to bridge the gap between inpatient and outpatient psychiatric treatment services, making sure that we provide a continuum of care and also address the disparities in healthcare across all communities. He has been a strong advocate as well in regards to addressing critical needs such as the opioid epidemic. Last but not least, Dr. Gregory Marcelle is also a Richmond, Virginia native, which is my home state as well. So all those Richmonders out there, thank you for joining. Dr. Gregory Marcelle is a dedicated healthcare professional with extensive leadership experience and a passion for improving organizational effectiveness. Dr. Marcelle specializes in working with children, adolescents, and substance use disorders, depression, anxiety, parenting, and co-occurring disorders. As the clinical director and CEO of his own company, Levels LLC, he oversees all staff through clinical supervision and training, ensuring quality of services are provided. He holds various degrees, including a doctorate in healthcare administration. He's a licensed professional counselor. He's also a certified advanced alcohol and drug counselor, a certified substance abuse counselor, and a licensed substance abuse treatment provider. That concludes the introduction of our panel. As you can see here, we have a lot of experience sitting on this panel, a panel that is comprised of all minority leaders within their communities. Thank you all for joining us as we dive into this important discussion today. All righty, let's go right on in as we have a lot to discuss. The first question is going to focus on a little bit about what's happening in the African American community. Why are we seeing that only 1 in 3 Black adults with mental illnesses are reaching out for treatment and not more? I'm curious, Dr. Marcelle, do you have any thoughts about the cultural factors that may be playing a role in the African American community that's contributing to the mental health disparities? And is there anything we can do to address this?
Yes, thank you for the introduction, by the way, Dr. Booker. So when I think of mental health disparities that the African American community struggles with, I first have to go back to historical trauma. Slavery, segregation, racism, and just us not having trust within, the community and our counterparts. That definitely plays a big factor in, some of the mental health disparities that we experience today. I think too, within the community, we also create a stigma within mental health, which that negative stigma that we do create, it deters us away from wanting to go ahead and seek help. So instead of seeking help from a professional, we may sometimes go ahead and seek help from maybe a friend or, a family member, which is not the best, because it's a lot of biases, and then they're just not professionally trained to help, you with severe and serious mental health issues.
Best friend, not a counselor? Is that what you're saying?
What?
Could you try again?
Computer talking to me. Sorry. I think also a lot of African Americans, we mistrust mental health professionals. I know for myself, when I come across clients and they're telling me they want a Black male therapist. If I was to go on Psychology Today and look up Black male therapists, maybe within a 50-mile radius, I will probably see about 5 to 6. So it's not a lot of us that represent for the African American community. Sorry, I don't know why excuse me. Yeah, so it's not a lot of us that represent for the African American community, and that causes mistrust within it, because a lot of times when they go to some of our counterparts, whether they're white, Indian, whatever race that they are, a lot of medication is pushed on them. We experience a lot of misdiagnosis, and that creates the disparity. And the last thing that I would state is the socioeconomic status of a lot of African Americans, with them being in low poverty or not having income. Or I'm even
not sure about that.
I'm sorry, let me move. I don't know what's going on with that computer. And even not being able to access the care that we really need. I don't know what's going on. Being able to access the care that we really need. So yeah, to help the second part of your question, what can we do to improve some of these disparities? I would say that one thing, collaborating with other healthcare professionals, collaborating with individuals who develop policies, faith-based organizations, any type of hospital, et cetera, and just really educating on mental health, putting more providers there, and doing more community outreach so that other individuals in low income areas and even high income areas, the African American community in general, so that we can be more knowledgeable about the resources behind mental health and the help that we all can receive.
Thank you, Dr. Marcelle. It's interesting. I was stating the fact that a lot of, minority communities, they feel more comfortable reaching out to their friends and thinking that they're going to help them get through a potential crisis. But you brought up a good point that they're not trained professionals. Additionally, one thing that you indicated was one way to overcome this is to work with faith-based communities. Well, a common myth is my pastor is able to help me with my mental health needs.
Yeah.
And I just, I'm curious on, does anybody have any thoughts about, is our, religious communities actually equipped to help us with our mental health needs? Because you brought that up. So I'm just curious on thoughts there.
I would like to add that African Americans traditionally tend to trust pastors more. The big issue here is trust. There's an overarching factor which a lot of communities try to ignore, the role that slavery played when it comes to trust between Black people and other races. And you cannot skirt past that because it's affecting us to present day. Oftentimes, when you go into spaces that they don't look like you, a lot of Black patients report not being seen, not being heard. So, and also being dismissed. And you may see someone who's Black who may be depressed, who they don't have the words to say anhedonia. They may express that they're having pain, they're feeling tired, they're fatigued, and a psychiatric evaluation is not done. Most psychiatric care is given in primary care. 80% or 85% of psychiatric medications is being prescribed through PCP. They're not offered therapy. They're most often offered medication, when that in itself is not the only context to treatment. So these are things. So if you're in a space where you're not seen, you're not heard, you're not going to go back. You feel pushed to the side.
And that's really great. One of the things, just even to your question about pastors and our church community, I think that that is a space, and I also think that's a space where there needs to be training, right? I'm not saying that the pastor themselves have to be, licensed, trained, but just I believe just kind of being in churches a lot of times, it's just like, oh, we're gonna pray about it. We're gonna, and not really understanding, especially that there are a lot of people in churches today that have trauma, and that yes, I believe in prayer, but I also believe that there are certain steps and practices and tools that we can equip individuals for. So I believe that it's important for churches to even partner with community-based services. They probably within their own congregation have, people that are trained to provide, treatment or therapy. So I definitely believe that churches are an access point. I also believe that there's opportunity for training for individuals that, especially, when we think about the rate of suicide and people having thoughts of suicide, sometimes that can be dismissed in that atmosphere of like, just get over it. You're not supposed to be down. You're not supposed, you're always supposed to be happy, and you gotta have faith. And that means you don't have faith. And so sometimes that can be a mixed message of that. So I think the partnership is really important. And then just congregations being trained. There's mental health first aid, which is is a tool that's out there in the community, just really giving individuals that are in those spaces baseline understanding of different signs and symptoms that you may see that in the individuals, and then get them connected to those services that can continue to help them while you're also being supported by your community. So I think that is really important when we're thinking about that.
That's awesome. And it definitely sounds like that behavioral health providers are those that are comfortable and appropriately trained in treating individuals with mental health needs, have an opportunity to partner with the faith-based organizations. That's part of the systemic change and strategy that maybe we can start to look into to make sure that that community is equipped, because it does sound like, I agree, that trust over time, that trust has been broken with the healthcare community. And so we have to figure out, how do we embed ourselves with that kind of community that is trusted, which is one of the trusted areas is faith-based community. So thank you all for expanding upon that question. The next area that I'm going to jump into might be a little bit touchy, but it's important that we talk about it here. So there's been a lot of recent circulation of videos and images of Black people dying at the hands of law enforcement, which is also one of those areas that's supposed to be a trusted institution that we have created within society. However, the numbers of lives lost most recently is shockingly. I can name a couple of names out there, such as Michael Brown, Freddie Gray, Eric Garner, Breonna Taylor, George Floyd, all under the age of 50 years old, and they died at the hands of an entity that is supposed to be a trusted entity. We already kind of talked about one way that we could potentially align ourselves as behavioral health or healthcare community to figure out how to gain that trust back. But Jessica, I can't help but to think and notice that you do sit on the board of local and regional jails in Virginia. So I do wonder, what are your thoughts about, is there a way for the community to try to feel safe, especially with healthcare? Because that trauma, even though it may be directed towards law enforcement, it does get expanded towards the entire, entities that are trying to help them because of that trauma exposure. So what are your thoughts about that?
Yeah, one of the things, just kind of thinking about today, looking at some of the statistics of the rate of incarceration for our Black males. They are our Black population. For 13% of the population that we are, 38% of us are um, our Black members they are incarcerated. And then when you start looking at those individuals that are incarcerated, about 37% in state and federal prisons, and 44% in local jails have a history of mental health or some type of current mental health up on incarceration. And then that percentage even goes lower when you try to look at maintaining the treatment once they're incarcerated. And so one of the things that we are definitely seeing are these high rates of, suicide that are in these jails. And it is very concerning, being really new to the board and really seeing the impact of that. And the first thing that I start looking at when we look at these cases is, where was their treatment? Were they seen in time? What's going on with their medication? And so I believe that there's a lot of opportunity where we need to continue to collaborate and partner with our facilities, with our prisons and our jails, to educate, right? I really believe it's about education, and it is about partnership, and not just education of, okay, this is this is a mental health, diagnosis, these are symptoms, but even education in what we are calling and thinking about cultural humility, right? Because I think that that is important. So even as in the world of, we have, DEI, and then, hats off to Forge for even having this forum, that has got to be expanded even into these systems that are responsible for caring for, for members right now that are incarcerated. So really training around cultural humility versus just cultural competence. Cultural humility is around a way of being, not just having this cognitive construct that, oh, I'm supposed to know about your culture. It's not that. It's a little bit more complex with that. And so the training, really having very developed training programs for those that are working in the jails and the prison, is one of those ways that I believe we can really address and really support individuals that are incarcerated, to make sure that they have access to quality care, and that care is equitable. Because also NAMI was also saying that that individuals that are incarcerated, Black individuals, non-white individuals that are incarcerated, are less likely to even receive treatment, or to even less likely, the thought is they may not, it's more criminalized versus a mental health issue. And so just really, and that's the work, right? That is the work. Even when we talk about the big system, there are individuals that make up these systems. And so we have to do our own individual, even those that are, even as Dr. Marcelle earlier was talking about, the treatment, the provider community. Sometimes we have to do our own work, the individuals that are providing the treatment, to address the biases. Are we practicing cultural humility? And are our white counterparts in the field practicing cultural humility? So that is, those are my thoughts, some of my thoughts around just really being in regards to what I'm saying.
Thank you. Thank you, Jessica. And some of the key things that I heard you kind of reiterating is that we need to make sure that those individuals, our Black community, African American community, is being treated for their mental health care prior to them being engaged in the law enforcement system. Because once law enforcement gets involved, it's less likely, is what I'm hearing, that they'll continue to get the proper care that they need. And in those extreme situations, when there is someone that may be dealing with a mental health situation, as I've stated within some of the earlier stats, and individuals that unfortunately have died recently, they're less likely to be seen as someone struggling with a disorder or diagnosis, but more of an issue in the community that needs to be removed. And so it does sound like this is one of the reasons why this topic is so important, just to kind of raise the awareness that there are things that we can do before it even gets to that point. So thank you, Jessica, for kind of sharing with us as well about what you're seeing sitting on that board. One
Dr.
thing
Cleo,
that,
sorry.
yeah, go ahead,
Sorry, I
Kurt.
just wanted to interject for 1 second. I completely agree with Jessica, right? From a clinical perspective, especially in the African American community, ODD, which is oppositional defiant disorder, right? It does lead to conduct disorder later on, right? So those are some of the symptoms that are, mainly presented in the African American community. And I think the program that Forge is actually implemented, the VFR program, that can be a bridge to bond that gap in a sense, right? Because, instead of leading to incarceration, it could lead to education in a sense, right? Because it is a diagnosis. In other races, they do get it treated from a young age, but as African American, due to the stigma, right, he's been labeled as a bad kid when it's actually a disease in a sense, right?
Can I
That's a great
add
point.
something? So with ODD, we often find even that has its biases sometimes, because compared to their counterparts, the counterparts, when you look at non-Black children, are being diagnosed with ADHD, or in some cases, there's trauma that's being explored compared to Black youths who are just labeled as defiant. And it almost starts like they get sent to alternative schools. They don't get the treatment that they need. And we know that if trauma is not addressed, Black children need to have an option outside of medication and penalization. Address the trauma so we can recover is possible, because guess what? If they continue on that path, they're going to be incarcerated. They will receive mental health treatment in prison because they have to treat them. And then when they come back out, that cycle starts over again. So we need to be more proactive in our approach with our youths to do a little deeper dive more than attaching a diagnosis to find out what's going on so that we can address that problem.
Hey, I would like to say something. And Nadine, one other thing I would like to add to that is that I think policy development has caused an issue within how we provide mental health services. Because when we talk about, giving people diagnosis, they make it so hard for individuals to get help. And sometimes the insurance company or whoever develops these policies, they're like, oh, well, we need to see these 3 diagnoses in order for this person to receive some type of help, which now can create bias within, the community of these mental health professionals, because we may see like, hey, this person may really need this service really fits for them. But now when we look at policy knows nothing about this individual. But because of policy, we're unable to provide this individual help because we can't provide these 3 diagnoses.
Yeah, and Dr. Marcelle, just to add on to that, when we think about the millions of dollars that go towards treatment compared to the money that goes towards prevention, that is, definitely just a disparity there, because you're right. In order to receive some type of service, you have to have that treatment. And so a lot of the money and millions are going towards, after the fact versus really looking at preventative programs that can really, interject and before there becomes just a full blown out diagnosis. So I think it is when we talk about systems and policies, and that has to be the ear, that has to be the conversation too, as far as really policies and laws around prevention before we get a full-blown diagnosis. Then the pipeline, I read in the and in the comments, someone was talking about the pipeline, to prisons. And so again, if we can really get with preventions programs and really get support that way, I think we could start seeing some turn.
I love this discussion, and the whole time as y'all were talking about slapping on diagnosis to our youth in order to get them services, I was thinking to myself as well, like, why are we spending more money on the services and not looking at prevention. And one really good example of the policy issue that Dr. Marcelle was mentioning was there are not a lot of states that are reimbursing for Z codes. So Z codes, if you don't know what that is, it is a diagnostic code, but it's basically indicating that there's a social determinant of health need. So we may be assessing for these SDOHs, and there's a big push in policy to understand when there is a social determinant of health need, but when a provider doesn't want to diagnose and we just want to document that there's a SDOH need that's contributing to the behavior that's being exhibited, we're not able to get reimbursed for that service. Z codes typically are not a reimbursable service. There are some states, which I applaud, is being a little bit more proactive, and there's some commercial payers that are being a little bit more proactive and allowing us to get a reimbursable rate for those Z codes, but the majority is not doing that. So that's an example of we actually have the ability to document the appropriate diagnosis. It's just that you're not fully compensating the healthcare kind of providers if we do document it that way. So thank you all. I definitely agree with the points that were made here today. We've talked a lot about how the system and society could adopt and change in order to help the Black community, but we are a very powerful community that has demonstrated resilience time and time again. We've demonstrated the ability to come together. We've demonstrated the ability to rise up. And I am proud of the history where we have demonstrated that even today, we continue to rise up over some nonsense that's happening in our world even today. So I wonder, is that, Dr. Kirt, being that you have been in this field for a long time, and Nadine as well, providing a vast array of services, any thoughts about how we can encourage the Black community, either those that are on the line, or if you are working with, you may be a clinician working with an individual that is a part of this community, is there any factors that are inherently a part of us that could help us overcome some of the challenges and mental health challenges that we're experiencing?
Yes, I think Marcel also touched on this also in regards to spirituality, right? You have to use what you already have, right? And embrace it in a sense, especially for the Black community. I think spirituality is used as a coping mechanism to deal with trauma. And it does help in a sense, right? Social support is also a very important factor, right? A lot of African Americans, they do rely on their friends, family for support also, especially, Caribbean descent, right? For me, personally, I use a holistic approach whenever I encounter a new client, right? I want to know the social factors, any major life changes. Triggers is always a big word, right? So triggers, it could be anything, such as a smell. It could be it could be anything that exacerbate any type of psychiatric disorder, right? For me as a African American growing up, right, seeking care wasn't always it wasn't the main, especially for mental health as a Caribbean descent. It wasn't seen as something huge as a medical condition, right? Whatever happens in the house stays in the house in a sense. So, it's good to have some type of cultural awareness, and it's not just an African American thing, Native American, they also have similar experiences when it comes to the healthcare system. So I believe cultural awareness in regards to clinicians, but also you have to understand each different background, whatever they use to cope in times of need, whether it's but via church or whether confiding in a friend or family. It's just understanding in a sense, I believe.
I would like to add that I often ask my patients, my clients, what brings them joy? Because we are so much more than our trauma. And it's easy to focus just on the traumatic experience of that is one part of the Black experience. And I often remind patients, clients, let's tap into some joy. What makes you happy? Do you recall the last time you were happy? These are the things. Talking to a friend, also providing them with tips on how to tap into that, getting to know them. Tell me of an experience that you've had that you really enjoyed. If it's even some simple as closing your eyes, which is guided imagery, imagine that you're there. And oftentimes they come to us in a vulnerable state, and we have to take there's a little bit of hand-holding that happens sometimes, and just even reminding them, do this thing. Some people need, especially when they're very symptomatic, they need that hand-holding and just a sense of reminding them, hey, reassuring them, this is a moment that you can get through. Also tapping into therapy. A lot of Black patients are not offered therapy. They need therapy also, not just medication. So those are some of the things that I do. Food, calling up a friend, going for a walk, holistically, supplement sometimes when needed. Because sometimes I'm Jamaican. Jamaicans say there's a tea for everything. So, finding out what their culture, when they're not feeling well, what do they do? Utilizing some of these because they are a whole. This is just one part of their experience that they're going through. And often, like Kirt said, Black people tend to be very spiritual. So just reminding them, like, you're going through something. This is a temporary piece, but once you're going through it, there is a other side that you're going to come out of too, and helping them with the tools to get to the other side.
That is a really great point. Because what I'm hearing is that, and I think sometimes our approach in service delivery is sometimes from a deficit model, and we really need to really move from a strength-based model to be able to to help individuals remind, like you said, Nadine, to how did you get through those moments? What was it in you that helped you get through that moment? And how do you leverage those strengths to help with other things, right? It doesn't mean that nothing bad will ever happen to you again. But when those challenges come, what are those strengths that you can use at that next challenge where there was not a total decompensation? And so really helping those that we serve identify those strengths. And then we as treatment providers also knowing that that individual that is sitting in front of us, there are strengths that got them here right now. And how do we use that in the way that we deliver services?
Yeah. I also want to add to, there is the trope of the strong Black woman. Oftentimes, Black women need to be reminded it's okay to just be a woman. Breathe. You don't have to be strong all the time. You don't have to figure it out all the time. It's okay not to be okay. And also to remind them this is a temporary, because when you are experiencing those overwhelming feelings, for you, it's the end all be all. So you come in as the voice of reason to say, hey, this is a moment. Cry if you need to, whatever makes you feel good. If you want to cry, scream, that's okay. And just be that, see them. I like to follow my clients a little closer sometimes, especially when they're going through rough periods, to provide them with support and also resources.
And to add to what Nadine just said, it's actually a framework. It's actually called the Superwoman Schema, SWS, right? And it's used to specifically examine Black women, because they're, like she said, the notion of being a strong Black woman, right? They have the habit of suppressing a lot of emotions in a sense, right? Showing resilience in a sense.
I love that. I love a lot of what you all said. It's okay not to be okay. That is one thing that I remind myself of every single day. I have moments where I'm like, this sucks. But then I have moments where like, I got it. The other thing that you all kind of pointed out is the superwoman complex, especially with Black women. I want to pair that with something that I think Nadine, you also was talking about, as well as Kirt, about tapping into things that make you happy, or culturally, like what does your culture do, right? So for example, I just want to go back a little bit, and even today, there are times where individuals may create a prayer room in their house. A prayer room is basically a space where you go and you speak to whomever you believe in. It could be a meditation room, whatever. But I would tell you that what happens in that room is a release of emotions. It is where you scream, you cry, you say whatever, you contemplate. And so that is an example of me. I have a prayer room utilizing in my culture, what do I do to help me feel better? And that is going into that space and letting out those emotions that I feel like I have to hold on to every day. So anyways, you all brought up a lot of stuff. I am also a proponent of making sure that our Black men are well taken care of as well. So yes, I am a Black woman, but Black men actually have the highest rate of suicide right now amongst all populations. I wonder, Kirt and Dr. Marcelle, is there anything you would say specifically about the Black males and what may be contributing to that increased rate of suicide, and what are some things that we can do around treatment for that population?
So I'll start. I think that the increase of suicide rate once comes from Black males feeling like they have nobody to talk to or nobody that's going to listen to them. It goes back to trauma. It goes back to slavery days, as the Black man was, the person in the household that had to take care of things and wasn't really emotional, but made sure that people were fed and money was made. And a lot of Black men struggle with pride. A lot of Black men have pride and they feel like, oh, I can't express myself emotionally because that's going to be a form of weakness, or, I don't trust this person because this person may use this against me, because historically, these are some of the things that not only Black men, but, women too have gone through. And just really allowing Black men, I work with majority African-American men and women. So the Black men that I do work with, one of the things that I like to do with them is help them with becoming more self-aware of who they are and who they want to be, and getting comfortable with that. Before they share it with anyone else, you got to work on yourself. So if you're not comfortable with who you are individually, it's no way that you can be comfortable with me or someone else. So really focusing on those self-love domains. And people think self-love, they think more socially, like, I'm gonna go ahead and do this for myself today, go to the movies, get my nails done, hair done, etc., and I'm gonna have me a good time. But you also have to explore that emotional part of self-love, that mental self-love, your spiritual self-love, your social self-love, your work life self-love, financially self-love, how you loving yourself. And once for me, once I work with the individuals and explore all these different domains when it's surrounded of self-love, then I can identify, like, okay, this is something that you need to work on. This is something that you're struggling with. And those are the things that I like to, work on African-American men with. Because it's important for us to be vulnerable within relationships as we're continuously trying to grow in life and succeed and, maneuver in however way that we want. So for other individuals who may not be therapists or, not in the healthcare industry, just allowing African-American men to be vulnerable without judgment and taking their experience for what their experience is, instead of trying to throw, our experience onto another Black man.
No, I 100% agree with what Marcel says, right? So it's self-care, right? Most African American males specifically, right? They think it's a form of weakness to actually seek any type of mental health care, right? And it's not only just a system issue, because sometimes the resources or there, right? It's just lack of education. So I think we as mental health professionals, right? Every chance that we have, we should educate on the type of resources, even though it's not 100% there, but the 50 or 60% that's there, we should educate them to utilize those resources, right? Suicide, right? It's not an anomaly to specific race, but like you said, Dr. Cleo, Black males, they do have a high rate, right? And some of it is associated with substance use also, right? So there's some accountability in a sense, but I think everything stems from education in a sense, right? We have to educate every moment we get to let them know that the resources are there if they need it. But I do agree with what Marcelle says, right?
I also think too that within our own community, sometimes we're the issue, because we're so
Yeah, I think
used
accountability, it
we're
has
so
to,
we're so
you
used
know,
to
it has to
fighting,
be shown in some sense.
so used to fighting that sometimes, Black men, sometimes they may come off aggressive, sometimes, they can come off many different things.
Mhm.
But when it feels like a fight to any other individual, then that's where it creates that resistance versus just allowing them to go through that moment in emotion, because we all know that emotions are normal. It's
Yeah,
normal
that's
for me
where
to be mad,
cultural
and it's
awareness
normal
comes
for
in,
me
right? We
to
have to understand the specific culture. Cultural awareness is very important, not just for African Americans, right? You have to understand
right.
each individual culture in a sense. So I think cultural competency should be priority in one sense, because it encompasses a lot of different factors: cultural knowledge, clinical skills, right? So that's my stance. I think cultural awareness is key to some of these issues.
And I think when you think about how we as Blacks are embedded in companies and systems where we a lot of times are the minority, especially as we are in leadership, I think just even Kirt, what you were saying, the education platforms, and again, I'm just again applaud to Forge for having this forum. It is extremely important when I think about just Candia Bailey, Dr. Candia Bailey. When I think about I can't remember her name. She was I believe she was out there at Harvard or Princeton. She was like the president. Um, gosh, I can't even remember her name, but she was let go. But I'm seeing a lot of just um, stories and testimonies of it, us in these large corporations or just in these companies and systems where we are not being cared for. We are having to navigate. And I think thank you, um, thank you, Claudine Gay. That's exactly what I was talking about. Thank you very much. Where we are in these systems where cultural awareness, cultural humility has got to be promoted, because there is a lot of suffering and pain that I am just seeing. And I think that we're all seeing when we look at Claudine Gray, when we think about Dr. Candia Bailey, and what those scenarios. And so the education piece, and not just education but also the doing, right? Sometimes a lot of programs, we may have DEIs, but is it translating into action? Is it translating into those relationships and connections, those one-on-one relationships and connections? So we just got to keep pressing and having these forums and having the hard conversations and the hard dialogue in order to really get us to a place of where we are healthy,
Yeah. This time has really flown by. I can't believe it's already 12:50. I do see a common question coming up in the chat that I'm gonna throw to the panel. And I actually really like the question that I keep seeing over and over. Forge Health provides specialty care to the veterans and first responder community. I hear people wanting us to comment on, and I see in the chat, like, what are our thoughts around what other resources may be out there for this particular community that is also a part of the veterans and first responder community. It comes with several complicating factors that may have unique needs. And any thoughts from the panelists around that intersection?
Oh, go ahead.
So our veterans, especially specific to Black veterans, are often overlooked. Their experiences with the VA oftentimes is not great, and they in turn may take longer to receive the benefits that's due to them. So as clinicians, we owe it to listen to them objectively without our judgment, do appropriate evaluations and history taken. It's important to get their perspective of their experience, and also to make sure that we are thorough with our documentation too, because this in turn equates to benefits for them. I have seen, like, as we get more veterans, for them, they're going through the process of doing evaluations and treatment and having their claims rejected. And we have to be here to provide them with services, not just make sure that they have other options. Like I keep saying it, with medication, because so many times African Americans are only offered medication. They need to know there is more to their care than medication. Also validating their experiences too, acknowledging it. You know, we say it all the time, when you see me, see them wholly, not just as a veteran, but as a person. You have to humanize their experience. And, you know, the VA too, like the VA is really sometimes, well, the VA's history is not great in terms of service to veterans. So sometimes it's a very long and tedious process for the veterans, but to know that in the interim, we are providing them with the care, whether it's IOP that they may need, medication, therapy, whatever they need. As a clinician, we have to bring that to their awareness or encourage them. And sometimes, you know, there's a lot of shame over, especially sexual trauma in the military, to make sure that we're approaching them from a judgment-free zone. Because if someone feels shamed in their experience or feel rushed, they're not going to open up to you. And we have to earn their trust. That's the most critical piece when dealing with veterans.
I think one of the other issues too, we talked about policy earlier, but definitely policy around, so I feel like the viewpoint of veterans services appear to be elite, and they're not as elite as what they should be. And then they make it difficult for a lot of providers to be able to provide services to veterans. So now you all have a limited amount of individuals that can provide you services, and then that's where it's a big gap. It's a large gap in between being able to, for providers like myself, being able to service veterans, because you all only have specific type of policies, not policies, specific type of insurance, or whatever it is.
Providers allowed, yeah.
Yeah.
Like you can only get services through the VA, or the TRICARE network may be limited, so forth.
Right.
Yes. Yeah.
And I've seen someone also put in the chat just now that they feel like, hold on. Often they think many of veterans tend to discontinue treatment due to poor treatment. But I don't think that's a veteran issue. I think that's just a holistic overall issue with individuals that go to therapy, because sometimes you have to shop around for a therapist. It's like going to the grocery store, to go find some new pair of jeans. The jeans aren't going to fit in the same way. So, if the person doesn't work for you within therapy, it's okay to say, hey, maybe we need to end this relationship, because I feel like you're not doing anything for me. And, I may not be doing what you need me to do, whatever the case may be, and just kind of end it and then go seek someone else that can be a little bit more beneficial for you. Because, you may have to go through 5 different therapists to get the right one. But if you really have desire to get help and treatment, that's what you're going to do. Because I know I'm not going to stay and get help from somebody that's not beneficial to me.
I love it. I love it. And as we move into wrapping up this awesome discussion, I wish we could keep going. So there might be a part two, never know, because it has been very fruitful and the time really has flown by. But in a couple of seconds or so, I would, I invite each of the panelists to, if there's one message you want people to walk away with, what would that be? And we can just, whoever wants to start first, go right for it.
I'll start. Since this is Forge Health, I think this is for all, not just Forge Health, but, it's for Forge Health, for all the providers or, anyone that's associated with Forge Health. I think when you do, provide care for our clients, right? You just have to think of what the meaning Forge actually means, right? It means a bond to put together, right? So I think, your care should stem from that association. That's just my take. Sorry.
I love that.
Yeah, I think what I would want to say is that it can be done. I know sometimes this feels like such a behemoth of a scenario when we talk about, the impact on mental health in Black America, but it can be done. And I think it's that one relationship at a time, that one connection at a time. So just remaining hopeful through the process, I think is really going to be really. So that's the message I would.
I want to add that we need to start having conversations about mental health in places, even when it's uncomfortable, so that we can erase the stigma surrounding mental health. We also need, I'm going to encourage everyone that's here, if you are not feeling well, I know it's hard when you're not feeling well, but you need to advocate for yourself. Or if you're not able to, or if you know someone that's not their best that you can advocate for, it's important that someone, because they can recover. Sometimes people don't have the words to describe what they're feeling. But if you know something is wrong and you talk to your primary care doctor, and you're getting pushed, keep pushing. Keep pushing, you're worth it. Keep forging, and we can all work together. We will need the allyship of non-Black partners to push forward in mental health, but we have to keep dealing with our biases and our own discomfort for progress to be made.
Again, thank you, Forge Health. Thank you, Dr. Booker, for putting this event together and your team. For everyone on the call, I would leave off with really just saying that if you're not aware of who you are, work on that. Whether you are a healthcare professional or whether you are a client or a potential client, any one of us can be a client. Just continue to become more self-aware of who you are. And seek out help if there's something that you need help with. We need to continue the conversation like Ms. Nadine stated, and just collaborate with one another. None of us are, it doesn't matter how many letters I have behind my name. I can see a client that's homeless and I'm going to still act like they're just as close to me. So really just being careful with people, being sympathetic and empathetic, and just knowledgeable about yourself on what you can handle.
Thank you, everybody. And thank you, panelists, for engaging in this important discussion today. Thank you for all of the individuals that joined this discussion today. As you can hear, it's time for us to continue to work together and continue this change. We want everyone to continue these conversations, take these conversations and start having them in your workplaces, in your community. We've given some ideas about how to work with the community. If you need a recap, you want to share this panel discussion today, please don't hesitate to visit Forge Health's YouTube channel here. So it is a very simple, youtube.com @Forge_Health. So thank you, everyone. I hope you all have a great rest of your day. And thank you for tuning in. It has been an awesome discussion. Bye.